take advantage of their civil right as well as their duty to participate and to contribute to the decision of the government. I want to, as I'm opening, I want to cover a few issues. I'm going to rearrange the agenda, and we're going to take items in a little different order. The first being that we will hear the presentation by the city manager on the actual proposal of what the city intends to do with the health department. And then we will entertain discussion for a resolution that has been presented. And unless we want to do it another way, but I felt it essential that we hear the actual presentation of what the plan is before we hear comment or make resolution decisions. With that, for the public comment, we will hear everyone that has signed up and is on the agenda, and the board can interact with those through question and answer. We will also hear all of the citizen comments for those that have come and signed up at the table. The only difference is we cannot interact with those that are not on the agenda. We can't ask questions. There won't be back and forth. But everybody gets a chance to be heard, and that's what I'm talking about with the your civic rights to do this. At this time, I would ask the city manager, Ms. Dumbo, I'll give the floor to her and ask her to make her presentation on what the actual city plan is for the health department.
Thank you very much. Nationally and at the state level, and if you hear me, it's on. Can you hear me now?
Use this one.
Wow.
Okay, we'll try it again. Are you getting anything?
No. Was mine working?
I'll try to get it. Just hold it. Just hold it in your hands. So you hold it up.
Okay. Are we getting it now? Okay, we'll do it that way. That'll help. Nationally, at the state level and the local level, we've all heard from citizens that expect all levels of government to make good business decisions, and that has prompted our efforts to look at how we're working in the health department. We believe the citizens expect us to live within our means. That's a big issue in these days and times, and to do the business of government differently. And again, that's how we began looking at what we're doing in the health department, and more specifically, what we do in this particular building. For the city staff, this discussion has been more about the building and the facility itself in saving money, not in the delivery of services, and I need to emphasize this. This is a facility discussion more so than a service discussion. I want to go back a few minutes and talk about the transition in the health department and the services that have been provided over many years. This certainly does not include all of the changes that have been made over time, but it will give you an idea of how services at the city have been very fluid over many, many years. First of all, we find in the city minutes that in 1955, there was a city-county health board. Now, we don't know specifically how that changed, but we do know that it did evolve eventually into strictly a city health department. We also find in those records that the city secretary was designated as the vital statistics registrar in 1974. So as we talk about vital statistics, remember that although the facility location for providing the service will change, the underlying service will not change at all. Okay, first of all, we find in our records that the pediatric clinic closed in the late 80s, that the maternal health and family planning clinic closed in 1995, as did the dental clinic. I don't know why those were closed or what deliberations took place during that time period, but nonetheless, those services were absorbed within the community. In the mid-90s, we find in the budget documents that indoor recreation and building inspection were even included as part of something called Health and Community Services. I don't know that they reported to the health director or to an assistant city manager, but that was all incorporated within Health and Community Services. In 2001 and again in 2009, the health education component of the health department was eliminated. First downsized in 2001, and then again eliminated in its entirety in 2009. These were driven by the cost of services, not because the city council or the management didn't want to provide that service. It's strictly driven by the price of services to the citizens. Animal Services was reassigned to an assistant city manager in 2007. It had previously, for some time period, had reported to the health director. Vital Statistics, that had reported for some number of years to the health director, was reassigned to the city secretary in 2009. And again, that was because the city secretary had served since 1974 as the official registrar of these documents. Vector control was reassigned in 2009 to the cemetery supervisor. We did that again because of cost. When the vector control resources aren't used and the people that work in that area, it was great to have them be available to help get the city cemetery back into really good shape. That's been an extremely effective program. Public health emergency response grants that come through Homeland Security, those are assigned to the emergency management coordinator who reports to the fire chief. We moved a second grant that relates to those to him in 2010. The most important part of this presentation that I want to be sure everybody at least appreciates, even if you don't agree, our service emphasis remains on providing the community the same level of service by using subcontracts, by reorganizing supervisory responsibilities, and by moving services and employees out of a very old building. At the same time, the city's taxpayers in the first year, the year that will start October 1, should be able to save about $400,000. That's in general fund tax-supported dollars. In the following year, that amount will be $800,000. To put that in perspective, that is about 3/4 of 1 cent on the city's tax rate. I believe from the conversations that we've had with the state health department that we will continue to lose funding from federal and state levels to support not just the health department, but it also in other grants that we receive in the city. For instance, our HUD dollars that come into the community development department, those are decreasing this year. We are not trying to replace those with general fund taxation. We know that airport funding for major projects has certainly been slowed with the discussion of the FAA, certainly not something that the city of Lubbock can cure. Another point that I would like the health board to consider is that as we talk about subcontracting grants that we receive from the state, if those are given to local nonprofits who are providers of health services, it stands to improve their ability to reach the community and the members of the community that we all know are currently underserved. In-house, we have also spent a great deal of time, mostly successful, not 100%, in being sure that our employees that work at the health department today have jobs in other locations. Let's go through based on the function basis, each of the areas and what those changes will be or what those changes won't be. The Board of Health itself, we're not recommending any change in its mission. They will continue to get all of the reporting they have gotten each month thus far. This would include reports from grantees if those contracts are awarded to other providers. We would have a community health coordinator. This would be Becky Brawley, who most of you know very well. She would work directly with the board. The position would be funded with a state regional grant. And then the city is willing to provide general fund support for the addition of a nurse. And when we talk about surveillance, we'll come back to that. That's an important point. I noticed from the information that Dr. Carr has provided in talking about a city board versus a county board, I think it's important to note that this will have some impact on that, and his comments should be considered strongly because he's hit on some very important topics. Restaurant and pool inspection, that will be the same level of service. That is a service that is provided only within the city limits. It has begun reporting to Stuart Walker in the codes department, and the folks that work in that area were relocated to City Hall. Birth and death records or vital statistics we mentioned earlier. We do about 9,000 records a year. About 18% of those are services provided to non-City of Lubbock residents. We will continue to provide that service on a county level basis. It will continue to report to the city secretary, and the folks will be relocated to City Hall. Vector control, as I mentioned, this had moved to the supervision of the cemetery director a couple years ago. The only change in that area would be its location. We would be able to move that, the trucks, the equipment, the supplies, and those things out of this particular facility. We do receive county funding, which in the coming year will be just under $145,000. It's a service provided countywide, and that would continue. Public health emergency management grants will continue to be managed by the Lubbock Emergency Coordinator. That's Lewis Treadwell, and he reports to the fire chief. We do have a decrease in funding in that area that we'll look at the end of the presentation. The city will be able to maintain that service level. This is a picture of the service level for the bioterrorism lab, which is a BSL-3 lab, and that is an item that is funded by the state for the most part. It does receive a small amount of general fund support. That general fund support has increased as the grants coming from state and federal government have begun to decrease. I think the important point to notice here is that it is in the blue area, and that is more than 60 counties that we serve from Lubbock. Fortunately, Dr. Presley has been very interested in assuming the responsibility for managing this. He has a great lab out at the Reese Air Force Base, and will be able to move that very expensive and important lab to the Reese facility. That's probably the most important aspect of changing how we use this particular building. We have two letters, one from the county, Tom Head, who supports the move of this lab, and he is the county emergency coordinator, and these funds do relate to emergency management at the statewide level. This is a state resource. And we have a letter also of support from the provost of Texas Tech, who's also supporting the move of this lab. Milk and dairy testing. This is a program the city has provided for years and years, and you'll notice on the map that we go all the way from Canyon down to something that looks like it might be Ward County down there in the bottom left-hand corner. All of the dots, they should look sort of purple, but that reflects dairies that we test here in the milk and dairy testing lab. It's all a service in the out to raise so that we continue to provide that service. It's certainly not a city of Lubbock responsibility. It is by state law, a state responsibility, but it is self-supporting. The revenue that we get supports the operation of that, and we believe that we can continue to coordinate with the state so the entire region gets to take advantage of that testing. We only have 2 dairies in the county limits of Lubbock. Water testing is also interesting. You can see from the areas that are shaded that those are areas that we test water for in the city limits. It is also supported a small amount by city tax dollars. There is a local privately owned lab that is gaining the certifications required to take that over. Our proposal, however, is to continue providing that service, move that particular lab to the water treatment department that obviously already has a lab, and get those services combined so that everyone can enjoy the same level of service they have today. And we can do that and again, get that particular lab out of this building. There's a little better picture of where we serve, and it is primarily in the county. Obviously, it's a county service, not just a city limit service. Before we talk about the STD map up here, let's talk about surveillance for a moment, because this is a very important point. Our plan is to continue the same level of monitoring and surveillance that we are doing currently. That's a real important point. That will be a coordinated effort. We will be using Becky Brawley, an additional nurse that will work for Becky, and will be coordinating with the emergency management director, who also has a nurse that works in his area that does additional coordination. I think that's a very important point. There's been a good deal of confusion, I think, as the public has heard about this proposal, that in fact that service would be eliminated. I do want to add that this surveillance function is a state requirement for the state to supply. It's not a health department requirement. It is not a city of Lubbock requirement, nor the county of Lubbock requirement. Nonetheless, we want to keep the people safe who live in this area and continue to provide that service. Next, let's look at the STD map. And you'll notice that we're doing testing far beyond the reaches of the city of Lubbock city limits. We have a grant that the state has agreed to fund again next year. There's a little better picture of how it works. It's certainly a service that is provided countywide, not just in the city limits. Again, that speaks to many of the comments I think Dr. Carr is going to raise. Here is a picture of what we provide through immunization. Again, this is a county, if not regional, project, as well it should be. It certainly is a program that reaches beyond the city limits. Again, that is a program that we get state grant funding with. We have sent a proposal out in the last couple weeks to change the method of delivery for immunizations and for STD monitoring and treatment. Our proposal is to hear back from those local providers that can assume that service. The state has very clear and precise requirements of how a grant is managed, whether you do it yourself or whether you subcontract it. Those proposals will be due back on August 22nd, and Becky Brawley and the nurses that work in that program currently will analyze those proposals and will make a recommendation that we can forward to the city council. Again, a real important point here is that the state sets the standards. We have absolutely no flexibility other than we do have the ability to subcontract it. Becky would be working with whoever is awarded those contracts and helping them set up how their programs run, how their reporting goes, and then to help them coordinate and reporting back to the Board of Health. We would be working constantly with whatever organizations are selected to be sure those grants are managed as they are managed today. I've heard some discussion that people won't be able to get to a different location. We have put on this map a picture of the city bus routes, and we have also put a dot on the map for those providers that we believe might respond to the RFP. Again, those proposals are not due back here until the 22nd, so we can only speculate on who might respond. Let's talk about money, because money is always the driver. And again, I think this is a requirement of the city council and of our leadership to be sure that we provide services on the best business basis as possible. Most of the money we spend at the health department is on people. If you look at these positions, you'll see in the general fund, it costs $366,237 after the grants pay their portion in this particular cost category. Once we're able to make a change, that number will go down to $1,757. That's the first cost center. In the second cost center, you'll see that we are at $419,077. With the change, that cost will be $194,235. If you look at this on a big picture basis and you combine those two cost areas, you'll see the number at the bottom that says $597,264. That's in what we would call the transition year, the year that begins October 1. That is the largest the number could be. Remember earlier in my presentation, I estimated $400,000. There are costs in closing a building or controlling records. There is a great deal of work during a transition year that we have not identified, and I would think it would cost a couple $100,000 to be able to be sure that we got all of that work done properly. And then in the following year, in the fiscal year 2012-13, the estimate is annual savings from then on of $835,000. That is indirect costs. That does not include any costs that we think we'll save in being able to close the building. It's just for savings we might have for technology. It's premature to make an estimate or a promise about what those savings could possibly be. This schedule shows you where we have been on these grants and why we are anxious to make some changes. Remember, this is only the first year of cuts that we have received from the state. The state health department does believe there would be additional changes next year. They're going through a very, very difficult time, And I can't tell you how hard they have worked with us to try to make this work for us and for them. They have lots of communities that are looking at how they provide services. Those are big numbers over there on the right-hand column about what the cost of the city is this year. The largest number, the 161, I don't want to overstate this. This is the H1N1 grant. That is a one-time grant. We didn't anticipate receiving it again this year. So as you total those numbers up, which get into the 300,000, please remember that 161 was never expected again anyway. One of the things that I think the maps illustrate is that the city of Lubbock taxpayers have been supporting really a county and sometimes outside of the county health service. Other cities, Dallas, for instance, does not maintain the city clinic. They do maintain the other items, same as we do. The clinics are actually provided by Dallas County. Fort Worth, the clinic is provided by Tarrant County. They do very similar other functions just as we have here. Plano, same situation. The clinic services are provided by Collin County. And again, they provide the same sort of services that we do, although they do have bioterrorism, but no lab. And of course, Arlington's in Tarrant County. Same services, and of course, Tarrant County is providing the clinic. The building that we're in today is a very expensive to maintain building. It was, I have two different numbers on when this building was built. One of them shows it in the 1940s and one shows it in 1950. It was a car dealership originally. That doesn't make it a really great clinic. It is a building that we're going to have to do something with if we're going to keep it, or that would probably be fairly expensive. Maintaining a clinic properly done would have to be a new facility somewhere else that the council would have to consider. So that has driven many of our proposals here in order to go ahead and move these services one at a time with the least amount of disruption. Again, that concludes my presentation. I'm happy to take questions from the board.
Thank you, Ms. Dunball. And at this time, if there are any questions from the board members, Dr. Reed.
Are we going to get a copy of this? Because I've never seen this number.
Right, we can make you a copy of the PowerPoint.
Good. I think it should be noted that the board did not know any of this until today. So it's rather difficult to assess all of this information in a very short period of time. But I think it would be helpful if we understood your last statement about moving the clinic somewhere else. What does that mean exactly?
The barrier in dealing with this building is what functionality would we need in a new building? Obviously, this building isn't going to last forever. We do have a master plan on building needs. I'll tell you that the police department is the immediate need for the next bond election that I hope the council will put in front of the voters. That means that the health department building will fall behind that, and this building has not had major repairs in many, many years and is expensive to maintain. So we have to do something operationally to prepare for the day that the air conditioning won't work or the furnace won't come on, because we're sort of at that point, as opposed to waiting just, we wake up one day and the building won't operate and we don't have the funding to fix it. So we have to make plans to either outsource to keep these services in the Lubbock area, Or we've got to put a replacement clinic in front of the voters for bond election.
So this building will be maintained for a while, is that what you're saying?
The building will have to stay here until we can get the BT lab relocated. It's the labs that are the most difficult to support in this building. The other services, and that's why I mentioned where they're going, most everything could be served out of a different facility. Obviously not a clinic.
Right. So the clinics will need to stay here for a while.
It's going to be open until the BT lab is relocated to Texas Tech.
When is that?
My understanding is working with the CDC, which will take a great deal of work. We're talking probably 6 months, maybe 9. Takes
So-
it.
So at the end of the 6 months, where will the clinics go?
Well, that's why we've sent out an RFP for other providers to take on those services and provide that level of services. There are numerous clinics that can provide that level of service.
Could you refresh me about, you mentioned about the surveillance program we're going to subcontract, for example, TB surveillance program we're doing very well. Who will be doing that if we go through the reorganization?
Becky Brawley will lead it, and Bridget, you're better explaining surveillance than I.
Yes, we will continue the same services that we do now in surveillance, but we will have less people to do it. Should we have an emergency, we will ask for assistance from the public health preparedness staff and the region and the state. But day-to-day surveillance activities will remain with the city.
It will remain with the city health department. Another question to Leanne. My concern with the subcontracting, the STD clinic and immunization clinic, of course, a lot depends on the RFPs we're waiting. We may get proposals, but my problem is, if things fall through the cracks, a lot of citizens may not be able to get these services.
I don't know why we think things would fall through the cracks. We'll go through a major evaluation process. We subcontract all of the community development services that come through on state grants. We have all manner of subcontracting that we monitor on a monthly basis.
I don't know physically, manpower-wise, some of the entities, the non-profit organizations, they're good entities, believe me. The community health clinic and Comvest Health, they provide good services. I don't know they're equipped to handle more volume without substantial
Yes.
changes.
Since we have those proposals on the street now, and we have an anti-lobbying provision, my suggestion is we wait and get those proposals back in, let the people that work here analyze them and see what their proposal is and what their capacity is.
Thank you.
Can you explain what the city's plans are for providing STD and immunization services should we lose this grant?
The city, if the grant is not received, the city will not be providing that service. That's a 100% state-funded grant.
I wanna say that I do appreciate your coming before the board today, since I think we've been kept out of the loop on this and have not gotten any information. And, you make a good point, which is, you said money is the driver. And I think from the perspective that you have, it all falls together very nicely. It's a defendable argument because you're given a very difficult task of finding ways to balance budgets. But I think inherent in that is the flaw, which is this isn't a budgetary issue, it's a people issue and it's a policy issue. So if I could ask some questions in terms of, for example, So you're saying that, the clinic here that September 15th, I'll be able to bring my child down here and get them immunized?
No, sir, I did not say that.
Can you give us a date of closing for services here at this building?
August 31.
Okay.
We don't have,
So August 31, those services won't be available, and we have not yet identified where those services will be. Another question I have is that, although I appreciate the testimonials that you received from the provost and from the Judge Head, could you share with us how many testimonials you've received from anyone in the medical or healthcare community that supports your idea? Did you talk to anyone in the medical or the healthcare community about this?
no, this is a budget issue for the city.
My concern, for having been involved in grant writing and administering grants, and I think Dr. Shakuru makes a good point, that this is an essential public health care service. And so in 2 or 3 years, if there are reductions in grants, such as Amarillo has experienced recently, and they've had to reduce their STD program by about $300,000, and they're currently now accessing hopefully some charitable associations there in Amarillo to help. That in 3 or 4 years, and I agree, these are good facilities. I think Combest Clinic, Community Health Center of Lubbock provide very good care. But I think they're going to be overwhelmed by the volume. And I think what's going to happen is in 2 or 3 years when the funding is cut, then what we're doing, and I think you've actually supported my argument by what you just showed with city counties throughout the state, is that in 2 or 3 years, CHCL says this is too much trouble to carry forth this grant. They're not going to want to renew it. We will have effectively dismantled the public health system here, so that when we come back, there will be nobody there to fill in that gap. And so you're throwing this to the county, and I would assume that if there's any, I've spoken with some county commissioners, and they're not real happy about you guys punting to them.
Well, keep in mind, we're not punting to the county, but I don't believe there's going to be support on the city council, and I've worked for them for 7 years, to raise the tax rate in order to support services that were formerly paid for at the state level. And I think that goes for tech stop money, it goes for HUD money. The city of Lubbock will not be able to absorb the changes that are made at other levels of government.
But this will be a hidden tax, because what's going to happen is, let's say that
There's
any
nothing
barrier to
hidden about
care
it. It's
will
not
result in
hidden at
higher
all.
rates of disease and disability. You're not going to get immunized, so 10 children don't get immunized. They develop whooping cough. They show up at UMCER, and they're not reimbursed. So these 10 children will be hospitalized. Pop on that's about $20,000 apiece. You've just spent almost $250,000 helping 10 children, and since it's not reimbursed, then it's going to be kicked over to the Lubbock County Hospital District, which means everybody that's a property taxpayer in this city and this county is going to pay it. So you're telling me the city isn't going to pay it? Well, no, you're making us pay it, because you won't spend $1. You want to spend $100, only you won't spend $1. We'll spend $100.
Yeah.
Please respond if you care to.
I don't think you asked me a question.
We can take a moment of jeopardy and let me reframe it.
Well, Dr. Carr, I don't believe the city council is going to support additional tax rate. I could be wrong, but I can count noses pretty well in order to support programs formerly funded at the state and federal level.
Well, this is
If the
interesting.
county would like to do that, I'm not going to debate for them. You can certainly make that proposal. I don't get a vote on it, but I do believe I understand the direction that they're interested in going.
Oh, I think the intent is to make this a budgetary item so that it floats under the radar, so that we never get a chance to have public input, and the city council doesn't have to have a public vote on it. My resolution is going to be good enough. It's going to be having this board make a resolution that will go before the city council, that will force them to make a vote, one up or one down, so that if they won't vote on it, we might end up with a new city council. I would like to ask a further question. So at this point,
Dr. Carr, I think that will really, for me, that will do it. I've made a presentation. I've explained explained what I think the council's goal is, and then I think from here, you'll need to get your votes with the city council on the board and what you all would like to do, and if you want to coordinate with the county, I think that's great, and if you don't, we're going to do everything we can to make sure that the current level of service continues, provided differently and at lower cost to the taxpayers in Lubbock.
So your position would be,
Really, I'm done.
okay, you're done. So you will not stay at this meeting and answer any more questions?
Dr. Carr, I've made my presentation. Thank you for having me.
So you're saying that you're not willing to stay around and answer any more questions?
Stay and answer these questions.
I have several more.
Are you being paid by the city that we support?
Um,
Get out of here and get these answers.
well, we will move on. The city manager does not want to answer more questions.
Okay.
We will move to the next, and actually I will, thank you, Ms. Humboldt, for your presentation. Can't hear me still? Can you hear me now? Okay. At this point, in the order, still revising the agenda order a little bit, Dr. Carr and Ms. Hinges have a presentation on a resolution. Would you like to present that at this time?
I would.
If so, then we will move to the citizen comments, and there are a few rules, establishing ground rules basically for the citizen comments that I'll go over in a minute. But at this time, I will turn the floor over to Dr. Carr and Ms. Hinges for their presentation of their resolution.
Thank you. As we're getting this set up for a PowerPoint presentation, I've got a resolution which I will put up here on the screen so that all of you in the room hopefully will be able to see it. But a few comments before we get started. I appreciate that we have several of the city council here today and our city attorney to hear the output or the input of the citizens. Last night in watching the local news, I saw Councilman Bean stated that he would vote in favor of providing better health services in fewer locations over less health services in more locations. Again, the problem with that is that if the city carries through with their proposed action, you know what we'll see? We will see less quality health services in fewer locations. Now, who has a councilman spoken with that supports this contention that we need to make these changes? He hasn't spoken with any of us on the Board of Health. I can't find anybody in the medical community or in the healthcare community that's been spoken to about any of this action. I have a concern that some on the city council and some in city government may have based this opinion off of staring at the menu and turning through their wallet. I believe that many from the public will state a clear case today that the proposed action is a mistake. I believe that the majority of healthcare providers in Lubbock believe that the proposed action is a mistake. I believe that a reasonable alternative can be laid out, that one can involve the common sense of our citizens. I am asking simply for a reduction in the speed of this, that we develop a public discussion that considers what is best for the people in our community. This is a policy issue and not a budgetary issue. Stealing the health of our children, our family, and our friends is not just a matter of dollars and cents. I ask that we, the board, allow us to move forward and consider this resolution. And again, the reason is that by taking this out of order, that I want to make sure that we maintain a quorum on our board so that we can vote on this, so that we can take it to the next city council meeting, where we can ask them to consider it and have them stand up and man up to what they believe that is in the best of the citizens for Lubbock. So I appreciate you letting us take this out of order and this consideration of the resolution. Be it resolved, and what I'd ask the board to do is that I will take these slides and realize that this is just the initial proposed resolution. So I'm certainly open and will accept any questions and possible amendments to what we have here today. But this was the first part of it. You'll find it in your papers in front of you, the actual resolution. Be it resolved that the Board of Health, in seeking to provide for public input and the collection of information, desires to put forward alternatives to the current action being taken. For example, as I said, the clinic's already closing. We're already transferring services. We're just now trying to catch up on this. That the citizens of Lubbock be provided the opportunity to engage with the Board of Health and City Council in gathering public input and opinion as to the services of the health department and the public health in general. That a proposal will be made to reestablish a city-county health service that had previously existed, allowing for a pooling of resource and service. My contention is that we're all in the same boat. And the city and the county need to get together on this because we each need to find a way to try to minimize costs, not duplicate costs. That the health board is in agreement, and I know that there will be some amendments of which I will accept for us to discuss on this. That we're in agreement with the relocation of the following current health department services. Relocation of vital records to other city property. Relocation of the bioterrorism lab to Texas Tech Health Science Center. Relocation of food safety and inspection to other city departments. Relocation of other laboratory services to other city departments. Given that I know that there's some issue on that, Kay, would you like to address some of the concern that you have on this particular panel?
I agree with most of this, but I think some of it has to be studied, and I guess it's the rush to action that is concerning.
Okay, so I would accept an amendment that we support this, but that there needs to be further discussion through public input in the future.
Yes.
Okay, other discussion? No. That the health board is not supportive of the termination of services in their present form and location for the following: immunization services, sexually transmitted disease services. That discussions take place with the county commissioners as well as other healthcare facilities seeking to find a more cost-effective building to house the health department. I would note that Covenant Health Systems currently has 2 closed clinics at 34th and I-27 and 50th and Avenue Q that will be well suited for clinical services. Alternatively, the current health department building might be better utilized by relocating other city services there, as opposed to the current plan where we're leasing space from Lubbock County for other departments. That discussion take place with members of the Lubbock County Hospital District seeking financial support for operational costs to provide for a new, smaller clinic. The district has run a surplus in their funding, and given the negative economic impact, the district will likely sustain under the present plan. They may be open to assisting and providing for those funds called for over and above the grant monies already awarded. Again, as I pointed out, you can pay it now or you can pay it later. Given that the bioterrorism lab will remain in the current health department building for at least 6 months, even short-term funding to maintain current services would be minimal compared to the cost of increased hospitalization costs resulting from barriers to care and reduced citizen compliance in obtaining immunization or treatment. That the Board of Health appoint a subcommittee to gather input and provide guidance in the following areas: to identify the role and responsibility of the to-be-created health unit director if services are to be terminated as currently proposed. At the present time, I'm unclear as to whether there are any defined guidelines concerning this position. I'd like to have us in this subcommittee discuss concerns about the management of grants that flow from the city to agencies not directly under the control of the city. Again, my concern is, do we have budgetary, administrative, accounting type people looking at this, or do we have clinical people looking at clinical services? I believe it's much better to have clinical people involved in what are clinical services. And then lastly, identify quality assurance and improvement standards to be maintained in either the existing action or in the proposed actions yet to be taken. That summarizes my resolution.
Thank you, Dr. Carr. Board members, you've heard the resolution, and I will, before I open it to discussion, I will recuse myself from the discussion and vote on the resolution. I have visited with the city attorney, and there is no conflict of interest. There are no legal issues, but the appearance of impropriety, I will back away ethically because I'm a Texas Tech employee and the facility is where the BSL-3 lab will be going. So I will turn the leading of the discussion over to Dr. Carr, who is the secretary, as you know, and
We should note that the resolution, the only addition is a friendly amendment received from Kay Hinges that we modify the language on the one panel that said that regarding the relocation of restaurant inspection, that this will need further discussion beyond what we have at present. Are there any other amendments, other comments, discussion? Dr. May?
Yes, Dr. Carr, I would like to add some comments to this. First of all, I appreciate the city manager for the excellent presentation and explaining to us the constraints that we're working under. In current government systems that we're dealing with, we have financial constraints, and the goal of our governments, particularly our local and state government, should be to take care of the health needs of the people, and I think you addressed that. I appreciate your resolution, Dr. Carr. You've made a lot of good comments. You put a lot of thought, and Dr. Henches also. The concern I have, it's a very complex presentation that reaches many conclusions. And I think where we stand right now, the concern that I particularly have, and I think the American people are sensitive to, is a sense of urgency in our government. It would have been good if we had had this discussion possibly 6 months or 8 months ago, last February. That would have been the ideal time where we could have worked out all the kinks. But people are afraid of the Trojan horse of urgency that exists in government. We look back at the Obamacare, stimulus program 1, all of these things that were pushed through and are going to, that actually impact this and are going to tremendously raise the cost of the health care that we're getting. So my suggestion is a more simple resolution, simply that we need to study this, we can put a committee together, we can work with the county and so forth, without drawing so many conclusions into the resolution itself. Those conclusions, I think, should be drawn by discussion, whether it be with our board, with a subcommittee of the board, with the county, with other entities, and we can reach those conclusions as we go along and get more facts, because we've just been presented with these facts today.
Okay, well, before we can consider any other resolutions, we'll need to take action on this one first, but certainly that can be
Just a
made.
comment made on your just making a comment.
Okay,
I'm not
all
putting forth a resolution.
Okay.
Making a suggestion to what I think could transpire with your resolution that would make it agreeable, whether we have a 90-day period of discussion or 180-day period of discussion. That's to be determined, but I think we're reaching too many conclusions in that presentation. And again, none of us have had a very long period of time to consider your discussion any more than we have had to consider the city manager's discussion. So we're put into the same situation. Both of these hit us without being adequately prepared, I think, to draw all these conclusions.
All right, thank you. Other comments? Dr. Reed?
One of the problems that Dr. May just said is the fact that, of course, we are presented with this material sort of at the last minute, and we are faced with things that are happening right away. And so, while I agree with Dr. May that it would be nice if we had more time, and it would really be a wonderful thing to take this slowly and carefully and analyze all the ramifications. Our problem is that things are happening right now, and we're sort of stuck with things happening. And so, as I understand it, and I haven't really had a chance to really carefully digest what you said, what we're really asking for is the city council to slow down and back off and give us time to reasonably respond to all of these problems. And so from that standpoint, I think as I understand it, that's the case, that's what we really need. We're really asking the city council to give us the time to look at this carefully before precipitous action takes place.
Well, yeah, certainly, since we have no authority to drive policy, we're just making a recommendation that will go forward to the city council that my guess is will then appear on the work agenda, and we will then be given the opportunity, as well as other citizens, to appear before the city council and offer further input. The purpose of my resolution was to give a structure to some initial alternative models, as opposed to sounding like we're just sort of whining about these changes haven't taken place.
Well, with that in mind, then I would definitely favor moving ahead with this.
Okay. Any other?
Brian,
Yes.
I fully totally agree with your resolution. I did not know that the immunization services and STD clinic services are ending by the end of this month. Is there any way we can make it part of the resolution to request the city council to continue the services until a final decision has been made?
I would accept that as a friendly amendment to the motion.
Thank you.
Okay. Other comments? One point of order that we've missed. My resolution requires a second.
Second.
Okay. Maybe just seconds. All right. Any further comment? Do I hear someone to call the question? Okay. All in favor of and so we're calling the question. We're now going to say we want to end discussion and move toward a vote. So we're not voting yet. We're just saying we want to end discussion. All those in favor of calling the question signify by raising your hand, saying aye.
Aye.
Okay. All those against? Okay. Now we move on to vote on the resolution. As stated with the additional observations noted from Dr. May and Dr. Reed, and then the friendly amendment from Dr. Chikuru that we ask the city to slow this down and continue to provide funding for 90 days. Did you say, Dr. Chikuru?
90 days.
90 days, ideally. Okay. All right. All those in favor of this motion, please say aye and raise your hand. Aye. All those against? Okay. Motion carries. Now, as we move on to other business, I will return it back to the chairman of the board.
Thank you, Dr. Carr. Thank you, board, for moving rapidly through that resolution. At this point, these microphones are bad today. Usually I talk loud enough, people don't want it. We will now move to the citizen comment section. And in doing so, I will establish a few ground rules. As you may know or have realized, there's 29 people signed up on the official agenda, and then another several signed up. I thought there were more than this. I guess there's 15 signed up today. The time, all the citizen comments will be timed, and each citizen will be allowed a minute and a half to express their comments, and with those on the official agenda will receive 1 minute of question and answer with the board. Those that signed up today will get a minute and a half to present their presentation, but because they're not on the official agenda, they can't interact with the board. So there's a timer, and when you come to the podium, please introduce yourself. I will call the speakers or the presenters by name off of the agenda in the order of the agenda. But when you approach the podium, please present your name and direct your comments to the board.
Question. Let's have a question.
Okay.
We were told that we had 3 minutes. And I prepared a 2.5-minute statement.
Because of the number of people that are on the agenda to speak, it is the discretion